Hey guys, Dr. Joel here. We're talking about the root cause approach. Guys, this is one of the most exciting topics to talk about for me because if you have ever dealt with some kind of really difficult and stubborn health issue, you've probably gone through the standard healthcare route and realized that so much of healthcare is aimed at getting to addressing your symptoms, which can provide relief, but in order to truly heal the body and to heal from these conditions, we really have to look at this root cause approach and kind of work through this model. So, guys, this is the healthcare approach that allows you to actually heal from your health conditions rather than just manage them forever. Let's jump into it. We're going to talk about kind of what this looks like, and then we'll have an example at the end with the thyroid system, but we'll talk about some other things as well kind of along the way. So, all health issues, our symptoms, our disease, our pain, it starts first with these root causes. Okay, so these root causes, these are the underlying problems. We're going to talk in a second about what those are and what those actually are and what actually causes these issues. Then that leads to dysfunction. Okay, the dysfunction is simply the suboptimal functioning of your body, and that leads to the symptoms, disease, and pain. So please understand, whenever there's a symptom, whenever there's a disease, whenever there's pain, whatever you're experiencing with your health, it goes back to dysfunction, and that dysfunction always has a root cause. And if you figure out that root cause and address it correctly, then it'll stop that whole pathway. Your body will actually heal itself. And guys, this method, this model, this is for every single health condition. The symptoms you experience and want relief from, that's the symptoms and so forth that you have from these issues. All right, so the symptoms, disease, pain, this is what most doctors address when you go see most doctors, most practitioners. They're looking at your symptom, your disease, your pain, and they're trying to figure out how to address that specific thing rather than figuring out what's causing the dysfunction, what root causes are there, and what actually does the body need to heal itself. So most doctors aren't looking at that. They're primarily focusing on these symptoms, whereas what we need to address for true healing is going to be these root causes. So what are these root causes? So here is an example of a number of these. We'll chat about them first. We'll chat about them for just a minute here. But please understand that there are more. This list is not a totally complete list here. So stress, right? Stress, high stress hormones, okay, and how those can put you in just that sympathetic pattern and take you out of the parasympathetic healing pattern. We have infections. So infections, this is actually a big issue, even in America, with parasite infections, bacteria, fungus, viruses. All of these things can cause a lot of issues with our system, whether it's our immune system, our gut health, our liver, our hormones, all of these different things. We have inflammation, right? And inflammation can come from a variety of sources, but that inflammation and understanding where that comes from is huge at helping to address some of these root causes. Nutrient deficiencies. Guys, we live in a world where our nutrients are lacking in our food here, especially in America. You know, it's the majority of our food in the stores, grocery stores, are extremely processed. The quality is not quite there, and so you have to really kind of search to find foods that are just so full of nutrients, good quality, all these different things. Between that and all the chemicals and the toxins and things that we're exposed to in our lives from day to day, nutrient deficiencies are extremely common, and so that is extremely common root cause that leads to all these different issues. Heavy metal toxicity is also another common one. And then lack of movement. Guys, these are just a couple different things. You know, you could also add in there, so the lack of movement, the sedentary lifestyle. You can also add in there like emotional distress. You can add relational distress. You can add a number of different things. Hormone imbalances, all kinds of different things in here. But I just wanted to mention these so you get an idea of kind of the main ones here. Now, if we correct these root causes, we address the inflammation, the stress, the infections, whatever is going on with each patient's case, that will stop this whole pathway. The body will heal itself, and it's really what we need to do to get to the bottom of things. So let's take this example of the thyroid. This is a hypothyroid example. So if you have high cortisol, high stress hormones, maybe that's coming because you aren't able to balance your blood sugar well. Maybe you need to eat more protein. Maybe you're eating too many carbs or sugars. Maybe you're snacking all the time throughout the day instead of doing 3 meals, 4 to 5 hours in between. Maybe you're snacking a lot, and that just kind of takes your blood sugar for a roller coaster. That can increase cortisol. Maybe you have some different infections. Maybe there's some kind of food sensitivity or hormone imbalance, and that's increasing your sympathetic function and just driving the adrenals to release more cortisol. This high cortisol will downregulate your thyroid. Okay, that's the dysfunction. And then we have the symptoms. Then you have weight gain, fatigue, brain fog. Okay, a lot of women come in with these types of symptoms and issues, and oftentimes they're aware and understand that it's actually their thyroid that's the issue. They just don't understand why, and they need help with that. Sometimes they have no idea what's going on, and it's really a thyroid issue. And then we have to figure out, okay, is it cortisol? Is it infection? Is it a poor conversion and a nutrient deficiency? You know, what else is going on there? So in this kind of condition, here is like an example of how we would address these things. So with this high cortisol, here's a couple different things that you really want to look at. And again, this is just a very brief example. In a lot of my other videos and content, we go further deep into specific conditions and so forth. But let's say you have high cortisol. You want to increase protein. That's going to be extremely important. You know, for women, I always mention you want to have at least 75 grams of protein a day, if not more. For men, at least 100 grams of protein a day. This is going to help you balance your blood sugar. It's going to help regulate cortisol and stress hormones. You might consider adaptogenic herbs. Okay, so ashwagandha specifically can be really good for the thyroid. Other adaptogenic herbs with high cortisol issues are like things like rhodiola, holy basil, which is also called tulsi, or maybe American ginseng. So these are just a couple of different examples. And then of course, whenever you have something like high cortisol, you want to investigate for any underlying sources driving the adrenal glands. Now, all of these things are going to be really important with addressing the high cortisol, but what can be really tricky is you can address that issue and still have some of those low thyroid symptoms. Therefore, you really have to upregulate the thyroid. So you want to upregulate and support the thyroid. So not only do we want to address the root cause, we also want to support and correct dysfunction if it needs any. And in this case, you might use something like zinc or iodine or selenium. That's going to support the thyroid, upregulate it, and then take care of the weight gain, the fatigue, the brain fog. You start losing weight again, your metabolism balances out, your energy improves, and then you can think a little bit more clearly. So here's an example of what this looks like in practice here, just kind of an example with things. And you can apply this kind of scenario to IBS, so irritable bowel syndrome. You can apply this type of issue to autoimmune conditions, right? We have to figure out what's triggering the gut, what's triggering the immune system, balance that out, upregulate and support any organs that are necessary there, and then your body will just heal itself, and it'll do the rest for us. So let's connect. So one thing I wanted to mention kind of before the end of this video is, you know, when we go back to these issues here as far as the kind of the root cause approach, usually what you're going to find is it's going to be some kind of holistic practitioner, some kind of functional medicine practitioner that's really going to use this model. One of the things that I always recommend is if you have access to someone that is certified in systems healthcare, the systems healthcare technique, I would strongly recommend that you visit them, even if you have to drive a ways, because they're going to be able to specifically test through the technique, test you, and figure out basically, number one, what's driving the issues of your complaint. Number two, what do you need to balance that out? And then number three, what do you need to do to maintain that balance to make sure things don't ever revert back? So guys, there's a link in the description to find a systems healthcare practitioner near you. As always, guys, you're welcome to schedule a free phone consult. We do 20-minute phone consults, and we can just chat through things there. You can schedule your first telehealth visit or visit us here in Dallas, and we'd love to see you for your first visit. Find us online at all the social medias. Guys, we'd love to connect with you. Thanks for joining us for the root cause approach. I hope this has been helpful. And remember, any and every condition can be healed by your body with addressing those root causes. So I just want to kind of put that out there. Now, some conditions are certainly a lot more difficult with things, and some conditions have extremely poor prognoses, but at large, for the overwhelming 99% of conditions, this is absolutely the case. If you can get to those root causes, the body will heal itself. So, guys, I hope this has been helpful. I hope this has been increasing your hope if you're dealing with anything. And I just want to thank you guys for joining. Check out our other videos, guys. We'll see you in the next one.